Do you have flat feet or your arches are dropping? My name is Dr. Russell Brokstein. I'm your top-rated freehold New Jersey chiropractor, and I want to discuss a major imbalance that is causing many people's knee pain, hip pain, back pain, even neck and shoulder pain. And what we do in our office, we're trying to show you how your imbalances from your feet are affecting these different areas. And by addressing these areas with the feet, we can actually help get better results to resolve your back and neck pain. One of the things that we use in our office is a state-of-the-art equipment that is a scanner. What we're looking for over here, right here, we're looking how the feet can affect. So if this foot here, the arch is dropping, it's going to pronate more, turning in, buckling the knee, dropping the hip on that side, and then the rest of the spine has to compensate and it'll tilt the shoulders. Many signs that you can look at when we evaluate a patient, many times the knees will buckle inwards or the Achilles heels will bow inwards. And you can also look at your shoes. And if you look back at your heels, you'll notice that you're wearing out your heels unevenly, and you'll more likely than not be wearing one heel out more laterally than the other. Another poster that we're going to look at right now is up on our wall. We can see how on our scanner, this is what a normal foot would look like, where we only have reds by the ball of the foot and around the heel. But when people's feet pronate, we're going to see more reds by the different ligaments of the foot that build the arches. And the more reds that we see from the scanner, we know the more severity of the problem. So what we're going to do right now, I'm going to have one of my staff members demonstrate how easy it is for our patients to use a scanner. We offer this to anybody, so even if you're not a patient, you can always come into our office during normal office hours and you could jump right onto the machine and it's done by you. You know, you do it yourself, jump on there, and it literally takes about 2 or 3 minutes. Now we're going to change with the video right now, and I'm going to take the camera and I'm going to have Morgan actually jump up onto the machine. So when you walk into our office, you can see the scanner set up, and she's just going to go through. The screen is touch. She's just typing in her basic information. And after she puts in her information, the scanner is truly state-of-the-art. It's nothing like what you see if you have heard about the Dr. Scholl's scanners in the CVS. They basically just put pressure down on the screen, and they're not really giving you a custom-made orthotic. Our scanner actually also has lasers in it, and when she has the scan going, I'll actually show a little bit of that. The lasers in the scanner actually measure the height of your arches also. What we're doing right now, we're actually just choosing the different types of shoes that the patient wears because each type of shoe needs a different type of an orthotic. So right now it's just telling her to put her right foot right in the middle of the screen. As you see, it's very easy to do. And we're going to have her put her arms down towards the sides. And as you see, you could see the laser actually go right through. So part of the scan is the laser measuring the heights, and then the other scanner is measuring the amount of pressure down on the surface. And once she completes that, it shows her foot, and she just makes sure that it matches up what we want it to be. There should be none of that white on the screen right in here. So her scan looks good on this one foot, so she's going to push next. And then she's going to switch her feet over to the other side. And then we're going to scan the other one. Again, arms are down to the sides. And again, making sure that the scan comes up properly and we see none of the fog around the foot, so it's an accurate scan. She's going to push next again. And this is just doing calculating of her results. Now, the other nice thing with this machine that we have in the office through foot levelers, it actually does a postural scan. So she's just going to turn to the side and she's now going to push the button. And it's actually going to take a picture. I'm going to stand away a little bit because it's going to take a picture from the side view. And it's basically checking to see how her ear lines up with her shoulders. And she can turn the other way now. And what we see here, you can come off there for a second just so I can get a better view. And on the screen, it actually shows the amount of pressure. We can see a lot more pressure on her right foot than the left. And it gives us a orthotics vital reading of 97, which on here, it shows that she's in a moderate category, which shows that she is prone to having more problems with her spinal regions due to foot and imbalances and mechanics. A lot of people usually show up in the severe categories. Very rare do we have in the optimal or mild. But as we go further, this then makes recommendations for our patients of what orthotics that we would recommend. And if we go next on here, again, these are showing different orthotics that might benefit her to help her. And as you see here, we actually have flip-flops. And these flip-flops are actually custom made for your feet, so you get better support during the summer months than if you're traveling and on the beach. So once we do this, we send to the doctor, and it actually will send me, sorry for that, once we send to doctor, it actually sends me a more thorough report where it actually shows us the difference in arch heights, and it shows us further how it actually is affecting your postural imbalances. So once we get the scan through, we can send the scan directly to foot levelers, and what they send us based on what we order, we get a custom fitted orthotic, and they're custom made for each foot. A lot of patients ask us in our office about the Dr. Scholl's. Dr. Scholl's, no matter what they say, are not custom fitted orthotics. The orthotics from them are basic support. They are better than not having any support at all, but custom fit are the best for you. A lot of people will go to their podiatrist and get fitted for orthotics. Many times podiatrists will do non-weight bearing casting. So they'll actually have you laying in a chair that's very similar to a dental chair, and you're laying back and they just cast your foot, but then you're not weight bearing, and we can't get a good reading of what happens to your feet when you're standing, how much your arches drop. The podiatrist orthotics also are usually very rigid and uncomfortable. It's like standing on top of a rock and then your foot can't move, and your foot is 26 moving bones. We need it to conform and move properly to absorb shock as you're walking or running. And you can see with these orthotics, they have a nice thickness, a nice cushion to it, and they do bend and give. And it's a better support for your feet, and it helps us get better results in balancing out your spine and helping you hold your adjustments longer. So I hope you found this very helpful. If you are a patient of ours, we highly recommend everyone get scanned for you to get better results with your treatment. Many times your insurance will pay the majority of your orthotic, and if not, we have payment plans to help you pay for your orthotics. So if you have any questions, please comment below. If you liked the video, make sure you give us a thumbs up or a little bit of love. If you want to visit our website, visit it at www.chiropractorfreehold.com or give us a call at 732-780-0044. If you have anybody else that would like some of this information, also share this video. So many people don't know the importance of giving better support to your feet. Thank you very much.